Hi, I'm here in Orlando with Dr. Ryan Cole. How many pathologists are there in the United States, Ryan?
Practicing pathologists, there's probably around 16,000 in the U.S., around the world practicing probably 40, 50,000.
And how many are doing the required stains to look for spike protein or your stains look for what, spike protein in the tissues?
Yeah, so looking for spike and nucleocapsid, which would indicate actual viral infection. In the United States that I know of, other than some small university studies, I know of one, me. And around the world, there's maybe 10 that are looking at post-vaccine deaths and post-vaccine injuries out of all those pathologists in the world that are practicing. Again, there have been some small university studies, and it's interesting because they've done one study or two studies, then they've gone silent, which is fascinating because we have the techniques, especially in those university settings. Some of these tests are complex or expensive, so you're not going to see a lot of small independent labs doing these, but there are a handful of pathologists in the world looking for spike deposition, vaccine mRNA deposition, and they are very few and far between.
So you've had now samples from bodies, from autopsies, of about 23, 25 patients. You've looked at 3 so far.
And there's spike protein present. There's spike protein in heart, there's spike protein in brain, there's spike protein in liver, but there's no nucleocapsid. And these were deaths proximate to, in most of these patients, their second shot.
And so, how proximate to the second shot are these?
The one was 5 days out, another was a couple weeks out, and another was a couple weeks out. Some of the others I have, most of them are within a couple of days to about 2 months. The other ones I haven't looked at yet, but the ones I've looked at, it's proximate to the shot, the second shot.
So a lot of people don't know that the actual peak of the death is like 5 months out.
Correct.
Do you want to comment on that because you saw the?
Yeah, it's an aggregate of multiple mechanisms: activation of other viruses, spike causing clotting, mitochondrial fatigue, and I would suppose in all of these, those mechanisms, there's multiple more. You saw my talk this weekend. It's about anywhere from 12 to 20 mechanisms, but the compounding of those mechanisms over time are obviously causing chronic disease. A great example of this is Dr. Malhotra in the United Kingdom, a cardiologist, prominent cardiologist. His dad was healthy, well, had a good cardiac exam. After his second shot, about 6 months later, his dad passed away. He had
severe coronary disease.
Severe coronary disease. So all these little mechanisms, the spike causes inflammation in the vessels. That's the primary route. Every organ in your body has vessels in it. So if you're causing chronic inflammation in the vessels, you're causing a chronic disease that eventually can lead to failure. In his case, severe atherosclerosis that he didn't have prior. So that's the question, is all these mechanisms, instead of like a wildfire where we see people pass away quickly from probably anaphylaxis from polyethylene glycol, in these patients we're seeing more of a smoldering wildfire until the burden of disease and the burden of inflammation finally adds up to incompatibility with life.
So you've been doing this stuff for how many years now?
Pathology, 26 years.
And how many bodies have you looked at?
Personally, I've done about 550 autopsies. Biopsies, I've done over 500,000 in my career. So looking at tissue is what I do all day long. That's my day job. And so 500,000 biopsies, that's probably the career of 3 pathologists. So I've done a lot in my career. I just do high volume pathology. That's how I trained at Mayo, and that's how I've trained and practiced.
Right, so this is not your first rodeo.
Not my first rodeo. And these are techniques, am I looking at it? Sure. Is this a technique commercially available to just about any and every pathologist? Absolutely. And should they all be doing it? Yes, they should. So any suspected death, all these sudden adult death syndrome cases, every single one of those, historically, if there was an unexplained death, those all got autopsied. And the coroner, the medical examiner, they can demand the autopsy. So these should all be autopsied. These techniques should be done. It's commercially available to any pathologist willing to look. And that way we have an answer for the patient, and we have an answer for humanity in terms of the harm these shots are causing. So this should be done anywhere and everywhere.